Doctors with disabilities exist in small but measurable numbers. How did they navigate their journey? What were the challenges? What are the benefits to patients and to their peers? What can we learn from their experiences? My name is Lisa Meeks, and I'm thrilled to bring you the Docs with Disabilities podcast. Join me as I interview docs, nurses, psychologists, OTs, PTs, pharmacists, dentists, and the list goes on. I'll also be interviewing the researchers and policymakers that ensure medicine remains an equal opportunity profession.
Welcome back to the Docs with Disabilities podcast. This is part one of a two-part interview with Dr. Rex Marco. Dr. Marco is a musculoskeletal oncologist and reconstructive spine surgeon who is living with C3 quadriplegia. He is currently the Chief Medical Ambassador for the Christopher and Dana Reeve Foundation, in addition to working as a clinician, investigator, and teacher at Houston Methodist Hospital. When we spoke with Dr. Marco, we were incredibly moved by his story, and we want to make sure to accurately transmit his eloquence and wisdom in this episode. As a result, we've decided to structure this series in a way that centers Dr. Marco's narrative, with fewer questions and transitions than we typically utilize on our show. Before we jump in, we encourage you to make yourself a tea or coffee and settle into a comfortable spot. This episode begins with Dr. Marco's recollections of the day he acquired his disability.
I felt like I was on top of the world, and I had just received a promotion to vice chairman of orthopedic surgery. I had a wonderful practice in reconstructive spine surgery and musculoskeletal oncology. I had a wonderful life and in terms of my family, with a nice house and a nice car, and I thought everything was great. And then tragedy hit me and my family. And what I didn't realize was that there was a lot more going on in my life and my family's life. What I soon realized was that I had a lot of unrecognized stress, anxiety, and depression. And what I now know is I was probably burned out. Through that process, I also learned that the stress that I was experiencing was leading to hypertension, prediabetes, and insomnia as well. And through that experience, I learned about living in the moment, in this moment, through mindfulness. And soon, I also realized that mindfulness alone was not enough, because I then entered a parent-driven recovery program, learned what true principle-based living is about. And through this recovery program, part of it included an exercise program where we would get out in nature and ride bicycles. And on one of these ventures, I was riding with the other parents and teenagers, and on one of the trails, I decided to turn left instead of right because it looked like an easier path. And as I turned back up on that path, the next thing I knew was that the tire and my bicycle were not going up the path, and I heard a crack. And I wasn't sure if that crack was my helmet or my neck or my skull, but I thought it was one of those. And in that moment, I started to breathe. I used my tools of recovery and mindfulness, and I started to breathe. And I took slow, deep breaths and felt that peace and serenity that I learned my breath could give me. And the title of this book, called Radical Acceptance, which I hadn't read, but I'd heard before, and I realized that it was important for me to radically accept whatever happened to me. I knew that it was a possibility that I broke my neck and that I could be paralyzed or severely injured. I didn't know if that was the case. And the next thing I did was to ask for serenity, to accept the things I cannot change, and the courage to change the things I can, and the wisdom to know the difference. And soon thereafter, my friend came running towards me, and I heard panic in his voice as he called my name. And I asked him to touch my leg, and he told me that he was. And I asked him if I was moving my foot up and down, and he said that I wasn't. And in that moment, I knew that I was paralyzed. And I also asked him to see if my arm and hand were moving, and he told me that they weren't. And because I could not feel and I couldn't move, I knew that I had broken my neck and that I was quadriplegic. And in that moment, I knew that there was less than 5% chance that I would walk again, and I may not ever go back to work or hold my unborn child. I don't know why I didn't feel sad in that moment. I simply knew that I needed to get to the hospital as soon as I could so that I could have my spine decompressed as soon as possible if there was any compression on my spinal cord. I also had visions of trying to pull on my head so that I could reduce my own spine, as I had heard stories of physicians doing this. I knew that since I couldn't move my arms, that was not a possibility. The only number that I could remember was my ex-wife's number, and I believe that's an important message since the advent and use of smartphones. Very few of us know many numbers. I believe it's important to memorize the phone numbers of people important in your life, because I could only remember one number. Fortunately, she answered, and she had my PA's number, and she called him, and thankfully he answered, and he was able to get in touch with my friend and colleague, Dr. Prasarn, who arranged to have everything ready for me when I got to the hospital. The EMS team came, and the first thing they wanted to do is put a C-collar on me and check my vitals and put me on a backboard. And my experience as a spine surgeon and orthopedic surgeon led me to also have thoughts, traumatic thoughts, of the patients I had taken care of who developed pressure sores from lying in one position. And I was always taught to remove people from the backboard as soon as possible, because when someone cannot feel and is lying on a backboard for a prolonged period of time, they can develop these pressure sores. And I had seen so many patients with quadriplegia have pressure sores, and as part of what I did was to take care of patients who had developed severe pressure sores that were not healing, and I performed around 50 hemipelvectomies to remove the pelvis bone and the lower extremity to help treat these pressure sores. And so visions of all my patients that I had taken care of came in through my head, and I knew that I needed to get off that backboard as soon as I could. When I got to the emergency room, as soon as my CT scan was done, I asked them to remove me off the backboard. And miraculously, within 2.5 hours of my accident, I was in the operating room getting my spine decompressed and reduced. And the miracle about that was that when I worked at that trauma center, it was almost impossible to get a patient with a spinal cord injury into the operating room before 24 hours. But a paper that my friend and colleague, Dr. Failings, wrote studied the dramatic improvements that occurred when patients were decompressed within 24 hours of their injury. And that pivotal paper led to my colleague and other colleagues at the trauma center to be able to work to get patients into the operating room sooner. When my operation was finished, I remember lying there in the ICU, and my surgeon told me that patients with my injury often benefit from a tracheostomy. And when he said that, I knew that I could take a deep breath and find relaxation and peace, and like I'd always been able to do. And I tried to take a deep breath on my ventilator, and I didn't have any relief. And my breath and my ability to breathe were gone. As many of you know, C3, 4, and 5 help keep the diaphragm alive. And with my injury, C4 and 5 bilaterally were not working. And so my diaphragm was not working and my breath was gone. And I asked him to go ahead and arrange for a tracheostomy.
In the next section, Dr. Marco describes the tools he used to process and accept what had happened to him.
I used a lot of tools that I had learned to help me with my minutes and hours and days. I knew that there were stages of grieving that were important for me to go through to get to acceptance. Stages of denial and anger and bargaining and sadness or depression. Yet I also knew that there was no denying what was going on. And for me, anger wasn't going to serve me. And yes, I had some bargaining that I was going to recover and walk and operate. I was going to do that by working as hard as I could. And I knew it was okay for me to feel sadness. And I knew that sadness was one step closer to acceptance. And I also knew that there was a plan for me to do something. I knew there was a reason for this injury, and one of the visions that I had was one of my childhood heroes named Christopher Reeve, and he starred in the movie Superman when I was a young child. And while he was riding his horse, he fell off and broke his neck and became quadriplegic. I remembered him on stage at the Emmys speaking on his ventilator to the world. And I knew that he had started a foundation to increase spinal cord injury awareness and find a cure for spinal cord injury through research. And I knew that part of my plan was to increase spinal cord injury awareness and raise money for research to find a cure for spinal cord injury. And I would also hope that I would be able to spread the message of mindfulness and mental health awareness. And most of my moments and days were spent living in that moment, not dwelling on the past or worrying about the future, being present in that moment with my ventilator breathing for me. With every in-breath of the ventilator, I could try to smell, and with the out-breath, I could taste, and with the in-breath, I could listen, and with the out-breath, I could feel. And becoming present with my senses helped me stay in the present moment with the breath of my ventilator. And there was a wonderful channel that played on the television called the Healing Channel. And the Healing Channel played images of nature with instrumental music. And I would watch this from the moment I awoke until it was over at 11 p.m. And these images of nature I knew had helped my patients live in the present moment and wean themselves off of strong narcotic medications. And I knew that if I listened to the music and watched these images of nature, that my brain would make substances like dopamine and serotonin and GABA so that I would be able to live in the moment and feel better, have less anxiety, have less sadness, and try to combat this insomnia that I had in the ICU. Every night I would play the Surrender Guided Meditation by Jason Stevenson, and my nurses were kind enough to play that meditation throughout the night. And I'm not sure how many nights or hours or minutes that I slept, but I knew that I listened to that meditation over and over again. And it really helped me through a difficult time. I also had a practice of loving kindness, which in Pali is called metta. And that loving kindness practice allowed me to start my day and ask, may I be kind and compassionate. May I be humble and accepting. May I be honest and accountable. May I be forgiving and committed. May I love kindly and kindly love. And this helped me start my day in a frame of mind where I was less likely to harm others with my thoughts and my actions. And although I couldn't move and I couldn't speak, there are definitely ways to communicate with my facial expressions, and I could communicate with anger or frustration or fear and harm other people, or I could do my best to communicate with love and compassion. I feel remiss in not mentioning another tool I used while I was in the ICU. I used a tool called the Panda Planner, and 2 weeks before my accident, I received my first Panda Planner. And every day before my accident and every day since my accident, I start my day with a short plan, and that plan includes 5 things. List 3 things I'm grateful for. List 3 things I'm excited for. List my daily focus. Say my daily affirmation. And have an exercise plan. And every day since my accident, I would list 3 things I'm grateful for. And they've always been the same. I am grateful for life. I am grateful for breath. And I am grateful for my recovery. And the 3 things I listed that I'm excited for: I am excited to see my family and friends. And I'm excited to see my caregivers and doctors. And my daily affirmation is always, I am enough. I am enough. And my daily focus is to do my best to be mindful and live in this moment. And when I say that, I breathe in and smell, breathe out and taste, breathe in and listen, breathe out and feel.
In the final section of this episode, Dr. Marco shares the importance of learning how to advocate for oneself and one's patients. Listen or read along as he shares the technology and organizations that helped him advocate for himself and taught him how to better support his patients.
I also learned how important it is to advocate for yourself and your patients. Like the time I knew that it was important for me to advocate for my friends to get me on the trail and on the way to the hospital. And when it was important for me to advocate for my blood pressure to be treated, or my ventilator to be fixed, or to get off of the backboard. Other ways that I feel that we can advocate for our patients is to keep in mind some of the technology that we now have available and is not always available for your patients. I remember lying there in bed wanting to be suctioned and knowing that one of my patients with C4 quadriplegia had to have a spit fistula placed, which is a hole in the side of his neck where saliva could empty out because he couldn't manage all the secretions. And I remember having a tremendous amount of saliva accumulate and having visions of a spit fistula the need for a spit fistula, and that feeling of drowning in my saliva and not having a way to call for help, lying there immobilized with no movement in my arms, not being able to suction myself, and not being able to call anybody because I didn't have a call button. There's a device that you can blow in and trigger a call to the front desk. And I was so grateful that my rehabilitation center had this device, because otherwise I would just lie there drowning in my saliva, having images of the need for a spit fistula. And thankfully, voice control came out on my smartphone device, and my friend tried to teach me how to use it. And it's such a powerful tool. It's not Siri, it's voice control, and you can control the smartphone by saying press 4 or press 3 or go to messages or open email. And my other friend said, there are these voice recognition systems like Alexa or HomePods, or Google makes a device as well that I think you could benefit from. And he sent me one, and my family and friends set it up in my room, and I could call my nurses or call my friends or family. And it's such a powerful device and such a simple thing. And a year after my discharge, another friend that I met who lives with quadriplegia told me about a sip and puff mouse that I can control with the use of my breath. And now I can use my computer, and in some ways better than before my accident. And so there are ways to advocate for yourself and your patients. Another important advocacy organization that I've been fortunate enough to be a part of is the Christopher and Dana Reeve Foundation. And Christopher Reeve wanted to find a cure for spinal cord injury. And his wife, Dana, wanted to help improve the quality of life that patients are experiencing who are living with paralysis. And through that, they've been able to raise millions of dollars to fund research, and as importantly, obtain funding from the government to run the National Paralysis Resource Center, which supports books and online information and blogs, webcasts to help patients who are living with paralysis and their caregivers. And they also have a peer mentor program that will pair you up with someone with your level of injury and age and gender. And these resources are so helpful when I'm in a bind and I need to learn more about my bowel program, my spasms, my pain, flying on an airplane, bathing, using a computer, thriving in life. I can reach out to the people that I've met through the National Paralysis Resource Center. And there are also ways to get involved, to give back to other patients living with paralysis and become a peer mentor yourself. Or if advocacy is something you want to do, they have a branch that helps advocate for patients living with spinal cord injury and paralysis at the national level in Washington, D.C. and throughout your community.
To our guest, Dr. Marco, thank you so much for joining us on the podcast and sharing your story in this episode. We are so grateful for your insight and honesty. To our audience, thank you for joining us for this episode. We strongly encourage you to listen to part 2 of this interview, available now, where our conversation with Dr. Marco continues to consider how Dr. Marco's time as a patient informed his perspectives on medicine. This podcast is the production of the Docs with Disabilities initiative and is supported in part by the University of Michigan Medical School Department of Family Medicine and Disability Initiative, the Stanford Medicine Alliance for Disability Inclusion and Equity, and the Ford Foundation. The opinions on this podcast do not necessarily reflect those of the hosts, their respective institutions, or the funders. This podcast is released under Creative Commons Attribution Non-Commercial Non-Derivative License. This episode was produced by Sophia Schlossman and Lisa Meeks with support from our audio editor, Jacob Feeman.